Andrew Chamagero, a journalist at NTV Uganda, has another chance at life after recovering from severe COVID-19 infection. Chamagero, while appearing on NTV's Sunday show, GXP, says he was in early May admitted in intensive care at a private health facility in Kampala.
The loneliness alone can kill you. And that's why I say that COVID is equally mental. You have to be very ready mentally to fight it. I knew I was weak, the body. But I decided to remind myself about the clear facts I know. My name is Andrew Chamagero. I have a wife called Linda. These are my kids. Because the drugs were so heavy at times you could have temporal amnesia.
Chamagero says he was charged a total of 18 million shillings after 2 weeks of critical care.
But every night, my dear Carlo, it was 3.2 million. So 5 days brings it to 16 million.
Uganda is dealing with an increased demand for critical care due to COVID-19, but the cost of critical care for patients with the infection in private health facilities has raised a public outcry, with some labeling them extortionists. However, Professor Frederick Sengoba, a public health expert, says critical care is costly everywhere in the world and will remain unaffordable for the ordinary folk.
The second point, critical care is very expensive. Government is not telling us how much it's costing. If they were to do a good job, for example, and we are able to understand the costs there, I think we will also find that taxpayers are paying a lot more money for critical care for those who are fortunate enough to get into the public system. If you consider how many nurses the patient should hold, a critical care patient will probably need about 10 or so nurses a day if you were to follow the WHO guidelines of nursing. Those who are going in public and getting it free get the false sense that these things are not as costly.
We visited International Hospital Kampala, commonly known as IHK, to understand the cost drivers for critical care treatment from a private provider's point of view.
It's beyond critical care. Private health care generally in this country has never been affordable to the general population. Our hospitals do not even serve 2% of the population. 60 to 90% of the people who come to us are insured, covered by insurance. About 90% for primary health care, about 60% for tertiary health care. If you took away insurance from these people, they cannot afford these facilities. So private health care generally has been financed by insurance, and today around COVID, insurance is only covering about 5 million of the bill, and that's what is really skewing this discussion. And there's been an information gap regarding the people who have been addressing this subject and not talking to the authorities about this subject. Even before COVID, when we talk about critical care, a bill for critical care typically for a patient who is severely ill for 10 days may go up to about 70 million.
According to the experts here, sundries and inputs into critical care are the determinants of how much you will pay once admitted into the intensive care unit.
The COVID-19 pandemic has kind of opened up a Pandora's box, and we find that patients really require a lot of oxygen as part of their care and management. The issue to do with PPEs, and these are the personal protective equipments that the staff use in order to provide care. So the manner in which they use them, and therefore the need within a COVID setting, a COVID treatment unit, is far much more higher than has been anticipated. And all that, of course, in the setting of COVID-19 pandemic. Then when we look at the drugs are also very, very expensive. The prices have really escalated over the last 6 to 8 months.
Dr. John Kasuja is an intensivist here. He explains the kind of care one receives while in ICU.
When such patients are admitted, aggressive methods are normally employed urgently to support their organs. These are the cardiovascular system, respiratory system, gastrointestinal system, the central nervous system. Any organ can be a trigger to fail others, or one may be failing in isolation, which later may affect even other organs.
A patient in ICU with COVID-19, unlike any other illnesses, requires much more oxygen and stronger medicines. And according to the health workers here, the prices for medical oxygen have more than doubled.
A cylinder of oxygen would cost about 500,000 shillings, between 400 to 500,000 shillings. And during this second wave, we've seen the price go up to between 1.5 and 2 million shillings for a cylinder.
We've done analysis and found that up to almost 45% of these costs are driven by PPE, oxygen, and medications. This is being combined with the number of days admitted in ICU.
We have supportive medications, vitamins, medications that support the cardiovascular system, to have good blood pressure. Technically, we call them vasopressors. An ampule of 4 milligrams can cost up to 300,000. Such an ampule in ICU can run for only 1 to 2 hours and it gets done. Most of the time we use up to 3 to 4 ampules. Most of the costs when a patient is admitted to ICU, they are what we call baseline costs, such as lodging costs, costs due to nursing care per day, the cost from the intensivist, that is the consultant, who is always inside full time assessing, and then the costs are from other specialists who come to review these patients and adjust plans.
From their explanations, the prices of medical supplies on the market are seen to have an impact on how much you will pay to the hospitals.
Some are going to exploit it, whether you call it unethical or ethical, I think that is another matter. Everything has increased by a significant amount.
Government has since made efforts to intervene with the aim of finding ways to make the service more affordable. As the first step, the Ministry of Health held meetings with the private healthcare providers, the Uganda Medical Association, the Uganda Medical and Dental Practitioners Council, and the Uganda Healthcare Federation. On Friday, while addressing the country on COVID-19, Minister for Health, Dr. Jane Ruth-Acheng, said they have reached some resolutions on how to reduce the cost of treatment.
1, the private health facilities should adhere to the COVID-19 treatment guidelines provided by the Ministry of Health. 2, regular quality assurance audits will be carried out by the Uganda Medical Dental Practitioners Council and Ministry of Health in conjunction with the private sector. And 3, government will explore the possibilities of supporting supply of oxygen to the private sector.
However, both Professor Sengoba and the Secretary General of the Uganda Medical Association, Dr. Muhereza Mukuzi, insist that oxygen is just a small fraction of what makes an ICU bill.
I think what government should do is to commit to pay for the oxygen that is being used and let private providers, public hospitals, get the oxygen in the most efficient way.
If you are serious, Mr. Government, touch on the biggest cost drivers, which is infrastructure, which is human resource.
The team that's handling waste management have hiked their price. Okay, so the volumes that are coming out of the waste that's coming out of the department is quite enormous.
Chairperson of the Medical and Dental Practitioners Council, Professor Joel Okulo, says they have established other areas where cuts can be made to reduce the bills.
I was looking at issues of billing, the way that they bill. I was looking at the hotel facilities of the hospital. This can be taken care of. I was looking at the prices of drugs, where some of the drugs which are being dished out, I mean, if you look at it in the open markets, what they're charging is way out of this world. So those are areas that we can bring the prices down without necessarily compromising quality. Unfortunately, you cannot leave healthcare to the forces of the market. Some formula has got to be found. It's not going to be arm twisting. We are going to be engaged in a series of dialogue.
It is not clear as to when the cost of critical care will subside, but The health experts advise that government should consider more investment in the health system, for example, meeting the Abuja Declaration target on health budget financing of up to 15% of the national budget. Uganda misses this target by more than 10%. Walter Mwesije, NTV.